It's a pretty different place, the OR, than the boardroom. When you're in the operating room, you're solving things in a very hands-on way. It's a very direct impact. And that's not the case when you're in leadership roles. Much more influence. It takes a little bit longer for the impact to be seen in most cases. And so that's the mindset shift. The focus still has to be about taking care of people, taking care of patients. So that part doesn't change. The vast majority of people go into healthcare because they want to help other people. And to the extent that we can start conversations with that and build from there, bring people together around that idea, that is just such a huge intrinsic motivating factor. And it allows us to stay focused on that singular idea. That's why we're here, and then solve the problems to get there.
Welcome back to Beyond the Bedside, a podcast by Peak Recruiter, where we explore the stories and leadership shaping the future of healthcare. Today, I'm honored to be joined by Dr. Murali Naidu, a physician executive whose career truly embodies what it means to lead beyond the bedside. Dr. Naidu began his career as a practicing general surgeon, spending over a decade in clinical medicine before transitioning into executive leadership. Today, he serves as the CEO of San Ramon Regional Medical Center, where he leads strategy, operations, and innovation within one of the nation's most vital healthcare institutions. With a background that spans frontline patient care all the way to the C-suite, Dr. Naidu brings a rare perspective of what it takes to build high-performing teams, navigate complexity, and keep people at the center of healthcare transformation. He has also taken on broader leadership roles across California's hospital community, helping shape the future of healthcare delivery at a system level. Given the promise of AI and the importance of how it can help improve healthcare, he will soon be exiting his role as CEO to join Vitea, a company that empowers health systems to safely and responsibly adopt AI by providing comprehensive oversight. This role will immerse him in AI and what it can do for health systems, how it can be implemented, and how to manage the associated risks. Vitea will certainly be an exciting company for us to keep an eye on. Murali, welcome to Beyond the Bedside. I'm excited to dive into your journey and the lessons you've learned along the way.
Thanks, Mike. It's great to be here.
Let's start by really helping people get to know a little bit more about you. You spent more than a decade as a practicing surgeon. What initially sparked your interest in stepping into hospital leadership?
What I started to see is that I'd sit in meetings at the hospital, and the clinical folks were really focused on clinical medicine. The finance people were talking about finance, and the operations people were talking about operations. And it really started to feel like people weren't talking to each other. They were just kind of talking in their lane.
Mm-hmm.
And I started to wonder, what would it be like if you really brought those things together and focused on, first and foremost, delivering great patient care, and then building the operations and the finance around that. And so that's really what did it. At that point, it was, all right, let's go test this out. Let's see what happens if we go down that path.
Interesting. And looking back, what was the hardest mindset shift that you had made moving from the OR to the boardroom?
Well, it's a pretty different place, the OR, than the boardroom. I'll tell you that. What I have found is that it is, when you're in the operating room, you're solving things in a very hands-on way, right? It's a very direct impact. And that's not the case when you're in leadership roles. Much more influence. It takes a little bit longer for the impact to be seen in most cases. And so that's the mindset shift. Can't change is why we're in this, right? The focus still has to be about taking care of people, taking care of patients. So that part doesn't change.
Yeah, I love that. And how would you say your clinical background has shaped the way that you lead as CEO?
It's really that piece. It's really starting with that foundation that we're here to take care of people. We're incredibly lucky in healthcare because the vast majority of people go into healthcare because they want to help other people. And to the extent that we can start conversations with that and build from there, bring people together around that idea, that is just such a huge intrinsic motivating factor. And it allows us to stay focused on that. That's why we're here, and then solve the problems to get there.
Yeah, I love trying to keep that at the patient at the center of our decisions and the quality of care that we're providing for them. In my role as a recruiter in this space, I meet so many folks, and oftentimes they have doubts on if they want to go into leadership or if they're cut out for it, or if it would detract from the mission they feel, this connection to patients. So for those clinicians who are listening who may be considering leadership, what signals should they look for in themselves to, perhaps encourage them to move forward with that?
Well, I would say that you've got to have that passion to want to make a change. You've got to want to be able to solve problems and be comfortable with the uncertainty that leading in healthcare today in the United States brings with it, because there is a lot of uncertainty. At the end of the day, we've got so much coming at us. And so I will say that that's an important piece that I hadn't considered at all when I started into leadership roles.
Yeah, absolutely. Yeah, I think it escapes a lot of folks and they don't naturally think about that. I appreciate you sharing. Let's switch gears a little bit and talk about, what it's like to lead during a time of complexity, right? I mean, hospitals today are facing workforce shortages, reimbursement pressure, growing community needs. So from your seat as the CEO, what feels most urgent?
Can I pick all of the above? Can we go with option D?
How many hours do you have in a day, right?
That's right. We really do have all of that going on, and they really are. They are top priorities. When you, for example, talk about workforce shortages, that's such a complex challenge in and of itself. It's a combination of not having enough of the workforce, right? Really, literally not having enough primary care doctors, not having enough nurses. There's also the fact that as we came out of the pandemic, we saw people moving around a lot more, and that's not historically something that we faced at this level in healthcare. So each of these components that you mentioned, each of these options are so complex in and of themselves, but they're all very much top of the list. They are so important to us being able to continue to move forward. We've got a lot coming at us at the federal level from a financial standpoint, at the state level in California. So again, all of these things, and I know that's not a very satisfying answer. You asked me specifically to pick one, so I already failed on that test.
Maybe it was an unfair question when we have so many priorities that we really just have to balance, as healthcare leaders.
I mean, the reality is that's why we need really talented people who are in healthcare, who want to lead and who want to solve these problems, right? And so to go back to your prior question, that's the passion that people who are thinking about going into leadership in healthcare need to bring. It is a challenging time. There's nothing easy about doing this well. And so that's what people have to want to be able to do. It's a time where we also need to think outside the box. Everybody wants change. Everybody acknowledges that we need to have change. But the reality is nobody wants to change. We can't keep doing things the same way, right?
You
So
bet.
so you have to be willing to be uncomfortable.
Absolutely. That's a great point. Being uncomfortable. Yeah, that change in particular is so true, And, with the workforce shortages, one, area that I hear a lot about, even though we focus on leadership here, I hear a lot about it and the challenges it's posing to the leadership teams that I support. I was curious that, from your perspective, how do you keep frontline teams, engaged during, these periods of uncertainty? And is there a leadership decision that you've made that you feel has significantly impacted, morale or performance that you'd like to share?
The most important thing that I've found is making sure that people are heard. And that's really, in the numerous ways that we do that. Walking around on a Friday afternoon and hearing from the staff about what's on their mind, answering their questions, really, in a boots on the ground kind of way, making sure that we're recognizing people when they do something that's really great and everything in between, right? And by recognizing them, making sure that we're recognizing them amongst their peers, because that's what really matters. It is so important that people feel like they are part of something bigger and that we hear them, and it's not just that we're all cogs in this big machine. That's what I have found makes the most difference and keeps people really so that we're all rowing in the same direction.
Absolutely. I appreciate that. So soon you're going to be changing gears, right? We mentioned it briefly at the beginning. And you'll be exiting your role as CEO there at San Ramon to join Vitea. So let's talk a little bit about AI, if I can bring that up. You've spoken about the role of innovation and AI in healthcare. Where do you see the greatest opportunity right now?
The greatest opportunity is that which reduces the mundane work in healthcare so that people can focus on doing what it is that they went into healthcare to do, right? Whatever that is. So if it's the nurse at the bedside, being at the bedside, those are the areas where I think AI is going to have the biggest positive impact on healthcare. Now, by the way, while there's a lot of work being done to impact that part of there's also a lot of work being done on the back side, the administrative functions, the back office, and so forth. Those are important, but to answer your question, and this time I won't try to say all the above, it really is that we have to figure out how to reduce that burden of non-patient care. So I think that's where the biggest impact is going to be.
Interesting. Yeah, there's so many thoughts about this, and I hear so many people asking questions about where we're seeing people or systems use AI, what they've had success with so far. The back office, most certainly, like rev cycle, right? Coding,
Right.
dictation, those are all areas. With that though, there comes this avalanche of, gosh, there's so many, AI solutions or ideas coming at us. It can be overwhelming for me, even in my space. So I was curious, your thoughts on, how you would evaluate, which technologies may be worth investing in versus the hype.
What I really want to see is that there's value that's being derived. There's actually a return, and it's not just sort of pie on the sky, right? Because we don't have the luxury of doing things that aren't going to make the business run better. It has to be about how we're making healthcare better, and there has to be a business case behind it. And that's just the reality of it. The financial pressures that we're under are just too great. Here in California, 53% of hospitals operate in the red. There isn't leeway to say, well, let's just go try something and see if it works. We have to try something because we know it's going to work.
Yeah, it's interesting how much of a tightrope so many hospitals across the U.S. are really walking on a daily basis. Um, and of course, with so much coming at us quickly and so many areas to run off into, this rapid technological advancement, I think is causing pause for some people, or concern, you could even say. So, what concerns you most about rapid technological, adoption in healthcare and the different ways this technology could be deployed?
What concerns me the most is that we don't know where this can be dangerous yet. We've got ideas, but I mean, we're talking about the most regulated industry, and it is first and foremost, like, how do we know that these tools are going to stay within the lane lines? And the answer is, we don't know for sure, but those are questions we need to ask. We also need to know what's being done with all that data. And these are processes that over the years, each health system has developed to make sure that any resource that we bring in, any vendor that we bring in, has to meet our IT security checks and so forth. But it's becoming more complicated in the world of AI. And so we have to evolve with that. When people are bringing solutions in quickly, we still have to answer those questions and make sure that this is safe. I mean, here's what we're facing, right? If you look at the black market price of a medical record, it's somewhere between $500 and $1,000. Just for comparison, if you look at the black market price of banking information, it's about $200. So this data, just as an example of the many things you have to think about, this data has to be kept very safe. It's incredibly important that we keep our eye on that, and again, evolve with this rapidly evolving technology to make sure that anything we bring in is going to be safe. We also have to know that we're using it effectively, and we have to teach people how to use it. Implementing is not easy, right? I mean, there's a lot of work that it takes to bring something new in, get everybody on board, teach them how to use it well, how to use it correctly. So there's a lot here, and those are the types of things that we're starting to think about.
Absolutely. Yeah, it's interesting, isn't it? It's like any new technology, or, Excel made, bookkeeping via worksheet easier as a tool, and AI as a tool as well, right? So how do we use it, and training people how to use it, where to use it? Yeah, that's a lot, right? I mean, this isn't just, a 1 hour session on a Monday morning that we're going to do with our employees, right? This is going to be an investment that we're going to have to make, and an upskill that almost all professionals are really going to need to invest in, and for themselves and for the organizations they serve. Looking ahead 5 years from now, if anything, do you think will look fundamentally different, inside hospitals? Any thoughts on that?
I have a high degree of confidence that in 5 years, the clinical decision support that we get from AI is going to be unbelievable, and it's going to allow us to deliver a consistency and a high quality of care that is just not possible today. right? And I think that's going to completely change the way healthcare is delivered. Right now, we've got all these disparities across geographies. We've got healthcare deserts. There's so many challenges we face as a healthcare system in the United States. And if we can raise the bar and make it an even playing field at the same time, that would be transformative. That's what I think. That's where I think we will be in 5 years. It's a very optimistic view, obviously. And so I would flip it and say, that's what we should be striving for. Let's make sure we get there.
Absolutely. Yeah, it's a good end in mind. And I think you're right. There's such an opportunity to utilize and leverage this technology to help. Gosh, I mean, almost everything you can think of. I mean, some days at night, I have problems going to sleep, right? Because you start thinking about all the cool things you can do within healthcare. I think about all the things we can do within our business and where is it actually useful, adding value. I love that perspective you shared about, does this actually return value? I think about that, does this help me accommodate my clients faster, do a higher quality of work, treat people and provide them a better experience ultimately, right? While also being more effective. And so far, the way that we've deployed our AIs, it certainly has been doing all of those things while not replacing anyone. And we've been busier than ever. So I'm not so on the gloom and doom of AI is going to replace things. I think it's going to be really a stand beside me and help us do better work, more of it, and to really help extend our reach. We can talk about,
right. It's like most things that humans get themselves involved with, right? There's going to be 10% that are the first movers. They're going to be really enthusiastic about this, and those folks are asking the questions that we're talking about. How do we do this? How do we do it really well? And then there's the 10% that's just afraid of it, and then there's the 80% that's going along with the flow, right? And those numbers, I obviously just made those up, right? But I mean, something like that is what it looks like. AI might shift. Maybe there are, more people in the 10% fear bucket. I don't know. The 10% where we're saying, all right, let's figure this out. Let's figure out how this can make things better, whether it's in your business, whether it's in healthcare more broadly. It's a really exciting conversation to be having.
Yeah. Oh, it really is. I'm sure that we could talk all day about that. And hopefully we can have you on the show again and we'll talk a lot more about AI. But I think the viewers would really actually appreciate knowing a little bit more about you, right? And, part of our series really talks to this idea of paying it forward, of helping people, the next generation get to higher levels of achievement in their roles, right? And entering the C-suite. It's so important that we develop future leaders, of course, and with so many folks retiring and the pandemic, of course, took its toll. We've seen burnout. And it's really, how do we have this next generation of leaders coming up? How are they going to be prepared? So I was curious, in looking back at your career, you've taken, some bold steps, in your career, from leaving surgery to leading multiple hospitals. And so I was kind of curious how you think about or how you approach the idea of risk.
Well, it's a really great question. Thanks. When I think about risk, I'm thinking from a professional standpoint, how do I make sure that the risk I'm taking is a measured one in that I've got to believe in myself. I've got to have the confidence that I will figure things out on the other side of it. You mentioned leaving surgery, and from surgery, I went into management consulting, knew nothing about what management consulting was, by the way, when I made that leap. And so really, saying, okay, I've researched this. I know what company I'm going to. It's a company with a good reputation. And most of all, understanding that no matter what happens, success is if you go there and you learn something new and you come out as a better fill in the blank, better healthcare executive, better surgeon, whatever it is. And then the risk is not nearly as much of a risk because you're going to win. And then it's just a matter of going out there, making sure that happens and putting in the hard work. Putting in the hard work that you're going to learn.
Yeah. Oh, sorry to interrupt.
Yeah.
What a great perspective to keep, though. I love that.
Well, and that's how I'm thinking about this jump to Vitea, right? I love what I do. I love building teams, leading teams, really focusing on how we improve care. And now I'm going to step away and I'm going to join a company that's focused on allowing health systems to use AI more safely, better, more effectively. And the way I'm thinking about it is the win is because I'm going to go and number one, I'm going to bring a healthcare perspective to the conversation that I think is really important in AI. Obviously, we've been talking about it this afternoon. And then beyond that, I'm going to learn, what can AI do for healthcare? How do we do it? And what are the risks involved? So whatever happens on the other side, I'm going to be a better healthcare executive.
Absolutely. Yeah, there really is no replacement for experience, right? I mean, that's, when I think about risk, it's more of what do I have to lose, right? Well, what do I have to gain is experience, knowledge, network, friendships, of course, hopefully success in achieving the goals that we've, set out to achieve, whatever that might be, you know. One thing I think that is difficult for folks that I talk to sometimes, and I think this goes across all industries, but in particular healthcare, is what habits, I guess I'll ask a question like this. So what habits or routines that, do you have that really help you stay grounded and perform well while also being in a high pressure role, like the role that you're currently in?
Well, in terms of staying grounded, it's really important for me to, I've learned over the years to get out there and do something that is exercise like. I happen to like to go running. And so, that's something that is just so important. It turns out less so for the physical health benefits. That's important, but even more so, just the psychological benefits of getting out there, doing something like that, processing thoughts from the day. So that's a huge piece. I also remember, I remind myself regularly that at the end of the day, when we have pressures facing us, those are really important, and people's lives depend on the decisions we make. And most of the time, those decisions aren't life and death at that instant, right? There isn't a patient on the table in front of me right now that's bleeding, and I've got to stop that bleeding right away. So I try to remember that context. And then on the other side of that coin, by the way, I also believe really strongly that as healthcare executives, we need to be really accountable for the decisions we make. So this is getting a little off on a tangent, but I find it's very easy to shift that accountability off of us. And, in medicine, we think about, or we often have errors that are either errors of omission or errors of commission, right? The two options. And most often in medicine, it's an error of omission when something isn't done right. We didn't give a medication at the right time. We didn't give a medication, whatever it is, we didn't do it. Those are a lot easier to shift accountability than, for example, in surgery. If you cut something that you weren't supposed to cut, you committed that error, right? That's an error of commission. Well, I think about the decisions we make as healthcare leaders as errors of commission. If we make a decision to staff a nursing unit, let's say more leanly with fewer nurses, that's an active decision that we've made. Mm-hmm. And so again, the other side of, we're not making decisions that are life and death at that moment usually. We still are making decisions that are life and death, and we've got to keep that in mind.
Absolutely. Yeah, easy to forget when the patient's not in front of you.
That's right.
All these little things we do lead to the culture and ultimately to the patient experience and quality of care they receive.
Yes, it turns out that doesn't translate very well to a spreadsheet, right? And we have to remember that those cells in the spreadsheet, there are people behind that.
Absolutely. They're stories, right? And they're someone's, family and friend, and people love these folks, right? Just like when our family's in the hospital, we want them to be well taken care of too.
Absolutely.
For leaders, that are mid-career, let's say they're mid-level, VP level, and they're looking, or maybe they're brand new out of college and they're just, getting started. But in looking forward, if you could give one piece of advice to the next generation of healthcare leaders, what might that be?
Figure out what it is that you really want to do rather than fitting yourself into a role that already exists. And then go out there and see what it would look like to design that role, find it somewhere. Because more often than not, you will be able to do that. I mean, if somebody had said to me as a surgeon that I was going to be the CEO of a hospital, I would have thought they were crazy. I mean, it wasn't even on my radar. But I realized what I really enjoy doing, whether it's in the operating room or whether it's sitting here in this office, is solving problems and solving problems in healthcare. So figuring out what it is that you enjoy doing and going out there and finding the job where you get to do that, there's just, healthcare has so many different opportunities. You can find it.
Yeah, almost limitless. And I love
Almost
that idea
limitless.
of chasing what you enjoy. In fact, it's one of the questions I haven't really thought of it before, but it's one of the questions I ask people first. what are 4 or 5 things that are most important to you? And right after that is, well, what do you love about what you do? And that's really what I'm looking for, right? What makes this person excited on a Sunday night to get out of bed Monday morning? And if they don't feel that way now, is there a way to help them feel that way by putting them in a better situation, maybe more aligned with their passion or their interests?
Yeah, and by the way, every job has something that you're not going to like. So, nobody should walk away from this thinking, oh, well, it's just going to be perfect, right? That's not a thing. But,
Sure.
I like to say, well, every job has its, 2 a.m. call from the ER equivalent for a case that, is going to drag you out of bed into the cold and you're going to be a little grumpy about. But that's okay because you still are doing good.
Absolutely. Yeah, I think it is important, especially for the new generations coming up. We're not going to like everything about what we do. And one thing that I taught my children, and I really love this idea, is that if it's not hard, if something's not hard, it's just probably not worth doing. Right? I mean, it's just things that are worthwhile typically tend to be difficult. And that's personal growth. It's leading complex hospitals like you do. I mean, it's amazing what you guys do every day. I'm always amazed by it when I meet and speak with folks like you and learn your story and what you do deal with on a daily basis. It truly is inspiring for the rest of us and really puts in perspective some of our issues that we have. I'm like, you know what? It's going to be okay, right? It's no one actually, passed away today because of something we did or did not do here on my end, at least. So, I love that. It's a little bit less pressure. But
well, you're too kind. I mean, the reality is that most of the things, and we talked about several of them. They're pretty straightforward. But you're right; it's not easy to do them, and therefore most people do them. Right? I mean, I said the so not profound suggestion of, well, you go out there and you talk to hear what's going on with the employees, and walk around on a Friday afternoon and make sure that they feel heard. This is not rocket science, but it's really important work. And it takes time. It takes effort to go do those things when there are a gazillion other things pulling at you. But that has to be the priority. So to your point about it takes hard work, it does.
You bet. Yeah. And it also takes prioritization into things that are most important. I love that. Well, Dr. Naidu, it's been really such a powerful conversation. I've gotten some good nuggets. I hope our audience has as well. What stands out, to me is your ability to really bridge these two worlds, the precision and the accountability of surgery with the broader vision required to lead an entire organization. Your journey is really a reminder that healthcare leadership isn't about stepping away from patient care. It's about expanding your impact, from navigating complexity and workforce challenges, what we talked about, to thoughtfully embracing innovation. Your perspective really reinforces something, we often talk about on this podcast, which, is leadership in healthcare today requires courage, clarity, compassion, and most certainly people willing to take a little bit of risk. So, really thank you for sharing your story and your insights with us. I can't wait to connect again and dive deeper into AI and what you are learning in your new role once you join Vitea. And to our listeners, if today's episode resonated with you, please like, share, and subscribe. We're building a community of healthcare leaders who are committed to moving beyond the bedside and shape the future of healthcare. Until next time, keep leading with purpose.
Thanks, Mike. Really appreciate it.
Okay.